Gauteng has got the highest numbers, now sitting at 302. We've actually geomapped them all. The large number of them are in Johannesburg. A few are in Ekurhuleni and in Tshwane and in some of the other areas. Western Cape has gone to 113, increased by 14 yesterday. And KwaZulu-Natal, that one is at 80, which is an increase of 20. But that's where we first got the first patient, and there is where the first 4 patients have shown recovery and zero conversion to negative status. Free State is at 18, an increase of 5. This is the one I want us to concentrate on. Here we had a church that had about 300 people, and it was over 4 days. And in this case, the church had 5 people who were visitors from abroad, all of whom, well, said about 7 who came from outside, but 5 of them were found to be positive, and they are actually still in the Free State. One has been taken to hospital, the others are still in quarantine. That's where we believe that the church got infected from, and we've tracked now all those contacts, and we've found that amongst them, those are the ones that tend to be positive. We've found them to be positive, as it were. I'll probably come back to that issue a little bit later. Northwest has now a total of 5 cases, and there's an increase of 1. Mpumalanga remains at 9, Limpopo at 4, and Northern Cape has got 2. With the one on Northern Cape, one has got a history of travel, but the other one actually comes from the church, to the extent that when we tested the person, they were still in the Free State. They have not even reached home, and so we are able to indicate that. Eastern Cape remains at 2. Those are travelers who came from outside the country who are still staying in that area. Then you will notice that there are some cases when we give you the statement who are unallocated per province. The problem with those is the numbers are increasing, and therefore we are starting to find missing information when the forms, when you're trying to track where this person will come from. It means that once we release to you the information, it would say unallocated, but when we get the information, we'll clean it up later. It will be long after the press briefing as well. The equipment that we have at the moment, we have not needed to use all the respirators. Right now, we've only got 2 patients who are supposed to be in ICU. I didn't quite get the sense that they were in the respirators. We'll keep checking. I'll check on the latest reports. But right now, they were ICU, but they were not really on respirators. The real issue here is that it depends how far the disease goes as to whether we can cope with it or not. Right now, we can still manage quite a bit. All the provinces are opening up extra beds to be able to dedicate them to the treatment or the admission of those who are infected with COVID-19. It's not possible to give any prediction. And if we were to try and give a prediction, it would be misleading to you. So we will not try. I just indicated that for the next week or 2, we still expect the numbers to be going up. And if there's any change, we can expect probably might start maybe sometime after that. Exactly when, I think it's not correct to be able to postulate. I want to just mention one aspect that our people need to understand that whilst there are lots of issues around the lockdown, there are a few things that we better consider. First one is that the lockdown must not give us a problem of shortage of food supplies, and the President has spoken about that, and my colleagues will deal with that. Also, they also have to deal with the protection of income. My colleagues have to deal with that. Those are very critical issues which are important in the management of any health conditions of various concerned. So all of these issues that you'll be raising are about supporting the health of our nation. They are all about ensuring that we keep our people in reasonably good health whilst we prevent the spread of infection. There is one caveat though which I want to mention here, and that is the fact that the lockdown helps us to reduce large numbers of people moving. wherein the infection flow would actually be unmanageable. However, it does not mean that lockdown on its own solves the problem. We still need precautions. We need precautions because in the experience of China, the 75% of the spread actually happened within family settings. In other words, if there is someone who's positive in a family setting, and then the family tends to be affected. That goes for smaller groups of people, and that becomes an important issue to be still considerate about. It's important for us to be able to give you a sense of where things are. But the rate at which the numbers are increasing, we expect that the numbers will still increase. I hate to give you guessworks, but we still expect the numbers to increase for the next next week. But once our whole program tightens up strongly, and we expect that probably, if there should be a change, we should probably start seeing it not next week, but probably towards the end of the second week or maybe the third week. It's taken Korea 4 weeks to actually start seeing the inflection of the curve. So we must say that we will expect that in the next week or two, these numbers, by the time we see the inflection, they will have probably gone three or four times or so. That's just one man's guess. It's not even a projection. I'm just saying that the numbers, we mustn't be shocked when we see them increase. But these measures, if we all work together, must turn the curve around. But it won't happen tomorrow. It won't happen next week. If there's any change, it should probably take us a couple of weeks before we can see it turn around.